Removing a kidney stone is as difficult a process as labor pains. You can be protected from kidney stone pain, which negatively affects the quality of life and causes stabbing pain, with some simple but effective methods. What is a kidney stone and how is it formed? Kidneys, being like organs located in front of the muscles forming the back wall of the abdomen on the right and left. If the concentration of substances that are excessively taken into the body with food or formed in the body increase in the blood, the amount passed into the urine by filtering through the kidneys will increase. In cases where the amount of water taken into the body decreases or water loss increases, less amount and more concentrated urine will be produced. For these reasons, the salts filtered from the kidneys, the concentrations of waste and chemical substances in the urine crystallize when they exceed a certain threshold value. As a result of the crystallization of calcium, oxalate and uric acid substances, they adhere to each other and form sands, and these combine to form stones. Kidney stones are of various types depending on their content. Calcium stones, which are formed by excess calcium excretion in the urine, are the most common kidney stones. Other kidney stones are struvite stones, uric acid stones, cystine stones, and sanguine stones that develop with urinary tract infection. Diagnosis of kidney stones is made by X-ray, ultrasonography, computed tomography, blood, and urine tests. What are the symptoms of kidney stones? Symptoms? It varies according to the size, location of the kidney stone, and whether it is obstructed or not. The most common symptom of kidney stones is pain in the area of the kidney. As long as the stone stays in the kidney and does not enter the upper urinary tract, it does not give any symptoms. Slightly large stones may make itself felt in the form of mild side pain in patients, and sometimes the pain may be in the form of a very severe crisis. Usually, when the stone moves from the kidney and enters the upper urinary tract called the ureter, the severity of the pain increases suddenly. The reason for this pain is that the stone blocks the urinary tract, and the kidney and the urinary tract behind the stone are swollen and stretched. In addition, stones moving in the kidney or canal can cause bleeding in the urine. These symptoms can occur singly or together. Can stone formation be prevented by paying attention to nutrition? The most common kidney stones are calcium and uric acid stones, which are associated with nutrition. In order to prevent kidney stone formation, it is the most effective method to consume sufficient amount of fluid by using correct and balanced nutrition programs. Easy to apply methods to prevent kidney stone formation. Drink plenty of fluids. Consume around 2.5 liters of fluid per day at regular intervals. Apart from water, fruit juices containing vitamin C such as lemonade, orange juice, and grapefruit juice can also prevent stone formation. Prefer freshly squeezed juices, and remember that concentrated juices can increase the risk of stone disease. Drinking orange lemonade is good for kidney stone pain, as lemons and oranges contain high levels of citrate, which removes the acidity of urine. Since apple contains fiber, it helps the kidney to perform the filtering process. Yogurt, a probiotic food, is very beneficial for the kidneys. Although high of fiber pumpkin is not widely consumed in our society, it is a food with numerous benefits. It is supportive in the treatment of kidney stones and facilitates the removal of stones from the body. Reduce salt use as much as possible. Excess salt consumption increases calcium absorption from the intestines. This causes more calcium to come to the kidneys, increasing the risk of stone formation. Reduce animal protein intake. Foods containing animal protein increase the amount of uric acid in the urine, which causes stone formation. Therefore, it is necessary to consume animal proteins, which are red meat, eggs, seafood, without going too far. Eat foods high in fiber and reduce protein intake. Meet your calcium needs. It is very important to get enough calcium in your diet. Do not follow calcium-deficient diets, as diets that do not include milk and dairy products increase the risk of stone formation. Some foods cause stone formation, especially in the kidneys. One of the most risky substances in terms of stone formation in the kidney is oxalate, and its consumption should be limited. Foods such as black tea, coffee, alcohol, beetroot, soy chocolate, cocoa, dried figs, black pepper, hazelnuts, parsley, poppy seeds, spinach, strawberries, blackberries contain high amounts of oxalate. Mixtures of lemon and olive oil are also preferred in the treatment of kidney stones. Thanks to the citric acid in lemon, you can easily reduce calcium-induced kidney stones. Mixtures prepared with apple cider vinegar and honey help dissolve kidney stones and facilitate the excretion of stones. In addition, people with genetic predisposition can prevent kidney stone formation by using apple cider vinegar. Mixtures prepared with nettle and blueberry reduce urinary tract inflammation. At the same time, they reduce kidney stones and facilitate their removal from the body. Don't forget to drink plenty of water. Bye. Don't forget to like the channel and subscribe.